Well, I've been in dentistry for 26 years, and I've been fixing teeth even when people had like great diets and they brushed and they flossed and they did all the things, right? And
Uh-huh.
then they would be, oh, clenching their teeth at night. You know, why? You're doing
Right,
all the right things and you're still ruining your teeth. So,
right.
what can we do? So, about 8 years ago, I went to a continued education course
Okay.
and I spent 7 hours in a room with a bunch of experts talking about oral sleep appliances. If you guys don't know what that is, it's a mandibular advancement device. So it's a piece of plastic essentially that goes on the top bottom teeth and it holds your mandible forward while you sleep.
Hmm.
And so the entire time they're saying that if we can get more patients in these oral sleep appliances, we can get them out of a CPAP because right now we can give them an alternative. Before, the gold standard was a CPAP. So I drove home. It was like a 2.5 hour drive. And I kept thinking, I'm like, I spent 7 hours listening to these brilliant minds and I paid this amount of money. And no one said why people can't breathe while they sleep.
Hmm.
And I'm like, that seems a little silly. Like, I know all about the plastic now, and I know how it works, and I know which brands there are, and who sells them, and how long it takes to get the lab to make them. But I
Hmm.
didn't know why people couldn't breathe while they sleep. And so I kept, if you get really passionate about something, you just dig and dig and dig and dig.
Yeah.
And there were a couple of experts here and there, like Roger Price and Patrick McCowan, and like these different people, on the wings of the stage, if you will, who were
Uh-huh.
saying, hey, how you breathe matters, and where your tongue is resting in your mouth dictates how easy it is to get air in and out of your body,
Right,
and all of these things where people were talking about the problem, but it wasn't mainstream, and it unfortunately it still isn't. We're
right,
still living in an era where there's not as many airway focused providers as there should be.
right.
And so yeah, that's how it started, was that one CE where they talked about an oral sleep appliance and not why people can't breathe. So my
Right.
job at that point, I self-appointed, was to show people what they could do to breathe better while they sleep.
Got you. So just to discuss those devices for a moment, just to clear things up for people. So one of the reasons why your airway may be narrowed is that, or if you're snoring, for example, is that your tongue can be blocking the airway and the airway can be a little collapsed. So the purpose of those devices is to just take your jaw and just shift it forward a little bit to open the
Mhm.
airway to pull more air in. So with that being said, what are from working with people, what have you seen as the pros and the cons for that? When does that work? When does that not work? Like, what are just the considerations around that device before we even talk about the other stuff?
If you're edentulous, if you have no teeth, you
Yeah.
can't wear it. Like, it's
Right, right.
dependent on teeth to anchor to.
Gotcha.
So right there, you knock off like 10% of the people that are edentulous.
Gotcha.
And then there's a lot of people that have TMJD. So
Yeah.
you talk about this a lot, temporomandibular joint dysfunction, and pulling that mandible forward is really hard on those ligaments.
Yes. Yeah.
There's a lot of people, like for me, I can't sleep with stuff in my mouth. I've tried it. I've tried, because I work in dentistry. So we've got
Yeah.
all the, let's try it before we pitch it. And half the time I spit it out at night. I don't like stuff in my mouth. So there's a ton of us that are just very sensitive to
Yeah.
having to sleep with stuff in our mouth.
Yeah.
If it's
And
central sleep apnea, that really doesn't
mhm,
help, because it's
right.
a totally different type.
Right. Yep. So with the temporomandibular joint disorder, when basically when your mandible gets shifted forward, it just puts more pressure on the discs, the ligaments also. And if you do have a prior issue with clicking, popping, or an actual joint dysfunction in there, it can produce irritation. So I see that as well. And that's why even with clenching and grinding, sometimes the strongest clenching that you can produce is through the molars. And typically, if you can shift forward a little bit and make contact with more of like the front six teeth, people aren't going to clench as deeply. So that's one of the strategies to reduce clenching, some form of as anterior deprogrammer where you're just shifted forward a little. But the people and there's a lot of considerations around that as well. Should you be in that position all the time? Should you not? Should you alternate devices? But the reason I'm tying it back to what you said is if someone has a joint issue as well, those devices for clenching and grinding can also be a potential issue. So when you have those TMD factors, signs, symptoms, all of these devices will probably be more problematic.
Yeah. And at the end of the day, you also have to look at it as like a Band-Aid. You know,
Mhm.
you're not curing anyone. You're not treating anything. You're just
Right,
simply making the air hole bigger.
right. Yeah,
You're not addressing the root cause. So I see it has a place, you know, as a short-term device
yeah,
for those who are candidates. But
yep,
I've also seen a lot of teeth shifting and bite shifting and people
yeah,
complaining about, you know, various reasons that they don't like it. It's too bulky. I can't keep my lips closed with it in.
yeah,
So it is a great appliance, right? Especially if nobody's going to do the work that we're going to talk about in the rest of this Instagram live.
yeah.
But I don't like it long term if it doesn't have to be.
So then, when we're discussing any type of sleep breathing disorder, what are the two categories you alluded to before with, a central apnea, and what would be the other consideration with that? And then let's just talk about causes for each of them.
Absolutely. So there's two types of sleep apnea. And apnea is basically where you just stop breathing, you guys. Like
Hmm.
the way the scale is set up, it's 10 seconds or more. And
Okay.
so there's two types, right? So we have central sleep apnea and obstructive sleep apnea. So
Hmm.
central sleep apnea is a neurological condition. It's where your brain is not sending signals for your body to take the next breath.
Right.
And there could be, like, Dr. Stasha Gomanak does a lot of work with vitamin Bs and Ds and acetylcholine, like understanding the neurological triggers
Right.
to take that next breath. And the other one is obstructive sleep apnea. That's where your body parts are choking you.
Right. Right.
And, you know, they're doing it every night and they just get more flaccid. Each night you struggle to breathe. And a lot of times what we'll see is mixed apneas.
Hmm.
It's the longer you go with obstructive sleep apnea, the more likely you are to experience both central and obstructive.
And apnea, when we talk about a sleep breathing disorder, so that's the umbrella, and then there's all different types of sleep breathing disorders, sleep apnea, snoring, and then less severe ones, right? So it's just a spectrum of disorders under this umbrella, which is called sleep breathing disorders.
Yes.
Okay.
Yes. And, you know, a lot of fit females, you know, because we were taught
Mhm.
obstructive sleep apnea was for like the white older male who was gluttonous and you maybe owned a train station. I don't know. We all had like a different
Yeah,
opinion of what that would look like.
right.
But it turns out, like for me, I had upper airway resistance.
Okay.
So I was in my mid 30s and I wasn't considered apneic because I didn't stop breathing. My body was so efficient at keeping me alive
Right.
that I would just stay in light sleep all night because every time I tried to go to REM or deep, I would just pop back up because the airflow resistance. And
Right.
there's, you know, a lot of us that get missed. And it's really sad because I didn't know what life was like on the other side of restorative and reparative sleep until I started working on my upper airway health. And now that I can feel what it's like to wake up refreshed.
Mhm.
You're
Right.
like, wow, how did I go my entire life? Because a lot of us, we're afflicted with this our entire life
Mhm.
without knowing what that was like.
So what we're going to dive into is the obstructive side of things for the most part, right? So this is your body parts, your mouth, your throat, everything that could be obstructing you from getting the air in. So when we move into that side of the talk now, and we're saying it can impact your sleep and your breathing at sleep in all different ways under that sleep breathing disorder umbrella. What are some of the structures or problems that produce this obstructive sleep issue?
Right. So the number one cause of obstructive sleep apnea is craniofacial respiratory growth deficiency.
Gotcha.
So just we're dealing with epigenetics, right? So our faces aren't growing forward and broad the way they once
Hmm.
were. There's a
Yes.
lot of features that are contributing to that, right? So undiagnosed and unreleased tongue ties. There's allergens. You know, a lot of these baby beds are coated with this fire retardant and it's causing all this nasal congestion. There's sugar in everything, which
Yeah.
is basically like a inflammatory trigger. We've got car seats. So babies they're falling asleep in the car, right? And a lot of parents are like, oh, I don't want to wake Jimmy up. So they just let them sleep in all these awkward positions where their airway is compromised.
Right.
There's pacifier use past 6 months. I mean, you don't realize how malleable a baby's head is until you put something in there every day for X amount of time and see what it does to the bone.
That's true.
There's a
Yeah.
bunch of examples online. You could just look up for pacifier face and
Right.
you can see just that constant pressure remodels the bones. And
That's
so then
wild.
we have to worry about not having enough room in the nose for air to get in and out. without resistance.
Right.
And then we have to worry about the actual arch of the mouth, because you guys know this. The floor of the nose is the roof of the mouth. They're connected. One's
Yeah,
upstairs,
yeah.
one's downstairs.
Right.
And so if the tongue isn't suctioned to the roof of the mouth because the child can't breathe through their nose, then the whole arch just grows like a cathedral, a very arched
Too
and
high.
vaulted, which is an example of what's in the nose, like the space that's actually in the nose available. And then the
Right,
tongue,
right. Makes sense
the
too.
tongue can't fit because the face didn't grow right.
Right.
And so that's the number one reason, is just craniofacial growth deficiency. And
Gotcha.
then as you get older, I have a ton of people that are like, oh, when I was in my 20s and 30s, I slept fine. I never snored. Everything was great. And now everything's awful. I snore every night. I can't wake up without a headache. I'm clenching and grinding my teeth. I get up several times a night to use the bathroom. I'm up between like 3 and 4 a.m. in the morning scrolling on Instagram. And it is just because our ability to compensate just reduces as we age, because you think about like muscle tone and strength and dilation of these soft
Things
tissues.
loosen up. Yeah.
Right.
Yeah.
And then
Stuff
hormones
falls
come
back
in.
more.
Yep. And so a lot of this craniofacial growth deficiency goes missed in childhood, and then as we start to age and we can't compensate anymore, things really take a turn.
Yeah, it makes sense just how malleable like kids, infants, babies' bones are, and how much they can be impacted just by habit and behavior, and really anything that's going to put a pressure on the bone. So so it's funny. I have a skull here too. So their chin being retruded back a little bit could be one of them, as you were saying. You're saying that the roof of the mouth, it can get too high. Then you can't get the tongue up, so you can't pull through the nose. As the roof goes higher, it automatically takes space in the nose itself. And then you have the soft tissues like the tongue and the throat, if they're too compressed on each other as well. How about like bigger tonsils? How about adenoids? How about just the structure of the mouth? I guess that would fall into it as well. Like sometimes I'll look into someone's mouth and we look at a Mallampati sign. So if you're looking at the uvula, which is hanging down, you want to be able to see the top of the tongue and that thing hanging right in the back of your throat with a nice space below it. And then if it's a smaller space, you're automatically the next class, a class 2. If you can't see the bottom of it, you're 3. And sometimes you'll literally just see roof of mouth and tongue. And again, that's automatically, you're not going to be able to pull as much air in. So you open the mouth up, you're not able to filter the air. And that also is, as we're going to talk about, directly tied to clenching and grinding as well. And then you go into fight or flight mode, and the muscles hurt, and you're in pain, and then you're in chronic pain, you're stuck in that loop, and it just goes on and on. So, what, and I don't want to keep like everyone in suspense of like, what are the things we can do about it? But just before we get to that, because I also have a lot of people that, you look through some of the signs and it's like, well, you're checking this box, like you have scalloping on your tongue, you're biting the insides of your cheeks, you can't see to the back of the throat, you're waking up with headaches, you're waking up kind of with brain fog, you're achy. If you get 8 hours of sleep, you're still exhausted in the morning, all of those factors. And it seems like there must be some type of sleep breathing issue. And one thing, there's sleep studies. So you can do at home, you can do at facilities to start seeing like, are you skipping breaths, like you said, with sleep apnea? Like, are you just snoring? Are there other ways that you're like deoxygenating where you might not fall into the sleep apnea class, but you're just under that umbrella? So if someone suspects that these things are going on, what's your experience with sleep studies or actually diagnosing if we should now move into treatment?
So unfortunately, you have to be your own advocate in the Western medical model. The doctors that you typically see, like your PCP, you get 7 minutes with them. They never ask you if you snore.
Right.
Unless you have like a diamond in the rough. Like I've never had my primary care physician say, hey, do you snore or toss and turn at night or struggle to breathe?
Right. No.
And so it was one of those things like, hey, I'm snoring. It's not normal. I need you to give me a referral to a sleep physician.
Yeah.
And that's where it's at right now. At some point,
to get the sleep study, to get
the sleep study. Yeah, you have to advocate for yourself to get a referral.
So then someone has a sleep study, and I know the at-home tests can be reliable in the fact that you're going to get more normal sleep, but the technology is not as up to par. And then at the facilities, they have the best technology possible, but you're in a bed with straps all over, and like it may. So like it's usually good to be able to have both for a comparison. But let's say you go through that, and let's just assume that the results are accurate, and you have a sleep breathing issue. Um, and now you said you look in the mouth, you look for these deficiencies in the growth of the bone.
Mhm.
What can you do about it? What do you do about it?
So I have a flow chart I really like to use.
Okay.
So you can't breathe while you sleep. What's next?
Mhm. Right, right.
Do you really want to treat the root cause, or do you want to put a band-aid on it? So the gold standard band-aid right now is pushing air down your nose. So we can
With
use
the
an air
machine.
splint to keep you from not breathing. And a lot of people are like, let's try it. It's insurance covers it.
What
I'm
what
going to
would
do
an
it.
what would an air splint be?
It's a CPAP. So it's
Like a
continuous
CPAP, yeah.
positive airway pressure. Mhm.
Okay.
There are two types. There's one that goes just directly on the nose and one that goes on the nose and mouth.
So if someone's not gonna go down that route, so let me ask you this then, so I can ask the question properly. The treatments that you advocate for or utilize, is this fall under like myofunctional therapy? Is it some other type of therapy? What is the term for it?
So when you're addressing the root cause being the soft tissues and the muscles of the upper airway, that is orofacial myofunctional therapy.
Okay.
It's been around for over 100 years. It just hasn't been utilized mainstream.
So then what are the treatments that are effective that you find for people when they want to go this more natural, holistic route where they're not shoving tubes down their nose, et cetera?
Right? It's actually addressing the muscles. So you want to keep the airway dilated, right? Without having to rely on an air splint.
Mhm.
So what orofacial myofunctional therapy is the ability to strengthen the muscles of the upper airway. So the tongue and the lips, and you're trying to, and there's a cascade of events that happen by the time you realize you can't breathe at night.
Yeah, let's get
you
into
know,
it.
it's happened your whole life. More than
Right.
like you were that kid that mouth breathed, had allergies, headaches, ear infections, throat infections,
Yeah.
enuresis. You had difficulties in school sitting still. You were tired and wired. Like this is stuff that happened to us when we were kids, and we've compensated, right, until we
Yeah.
can't compensate anymore.
Right.
And so because of that, we have so many issues by the time we address the problem. We have
Mhm.
forward head posture. We've already had like our teeth from the clenching and the grinding. We've already worn down enamel. We
Right.
have these posture habits, right? Like these pelvic tilts and and these
Yeah.
poor sleep hygiene issues. Because I don't know about you, but when I I woke up tired every day. So I
Right.
never prioritized. Like they kept saying sleep hygiene is important. I'm like, whatever.
It doesn't make a
I
difference to
barely
me.
sleep.
Yeah. And a
I
lot
could
of
do
people say that the more they sleep, the worse they feel also.
Yeah, I would go 9 hours and wake up so tired. I'm like, this is my life. This can't be
Right.
my life.
Right.
And so by the time we start to address these root causes, we have a lot of catch up to do. We
Mhm.
have to work on the cervical spine. We have to work on diaphragmatic breathing. We have to work on getting the tongue to stay suctioned
To
to
the
the
roof of
roof
the
of the
mouth.
mouth.
Right.
There's 8 muscles in the tongue, and a lot of people don't realize how inflammation plays a part of that, right? So you can
Mhm.
get fat in between the muscles of your tongue, you guys.
Mhm.
And so everybody's like, my tongue's too big. It doesn't fit in the roof of my mouth. I'm like, it's a hydrostat. It will fit in the roof of your mouth, but you got to get it stronger, and you got to get those muscles so
Mm.
strong that they stay suctioned to the roof of your mouth.
Mhm.
And it actually helps open up the airway, right? If you
Right.
lose inflammation. I have a guy, he's like, I don't know, 5% body fat. He's a weightlifter, and he can't breathe at night because the
Mm.
muscles of his neck on this flaccid tube are compressing it.
Right,
And
right, right.
so there's so many factors that come into this.
So let's say that someone, you know, fixes their posture and the way they move from the neck down, right? So we've looked at the hips and the ankles and the shoulders, and we have the cervical spine moving better. We've even checked the TMJs, and functionally they're able to hold themselves in a better position, and they're doing all that, but they still feel that they're having difficulty breathing. So some people feel, because again, what you were saying about the actual cranial structures themselves, some people feel that ideal posture is here, but when I come back through here, I almost feel like I'm compressing the throat itself, so I can't breathe. So I've done all the work to change this as much as I can here, what can you do? Like, what do you specifically, I guess you kind of went to it already, but what are the strategies or what are the specifics that you would start looking at inside the mouth and kind of nasal cavity, like right in that region there?
Right. So, a lot of us who are habitual mouth breathers,
Hmm.
not necessity, but because it's a habit at that point,
Right.
we don't like resistance, right? We're creatures of habit and we like everything convenient. So the
Right.
fact that I have to pull air in and out of the small holes versus the one big convenient hole,
Right.
it takes more effort. You have to adapt to it. There's CO2 regulation. And so just getting the nose to work better. That's what
Mm,
like nasal sprays and irrigation. And like there's so new headband now that decongest your nose. It's
right.
getting rid of inflammatory foods, reducing the swelling in the nose just by
Yeah.
producing more nasal nitric oxide, which if you
Mm,
guys don't know, nasal nitric oxide is reduced or it's made on the exhale of the nose. And like all of these gurus and breathwork people, they're like, take a deep breath in and exhale it like through your mouth. I'm like, no,
yeah.
that's your opportunity to make more nasal nitric oxide. It's
So to
only on
go
the
in,
exhale.
so the best way to be practicing this is transitioning to nasal breathing, both inhaling and exhaling.
Absolutely. You're slowing down the breath. You're, going into the rest and digest system. You're
Yeah.
starting to regulate the CO2, O2, because you need CO2 to offload the O2.
Hmm.
And yeah, it helps to reduce the inflammation in the nose itself. So
Right.
you can make
Okay.
what you have work better.
Interesting. Yeah. 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 So, I mean, usually I do tell people as well that one of the easiest things we can do to see if you're breathing through your mouth because you just can't pull air in the nose is, let's just make sure there's not some stuff in there that you can't, that's blocking the airway. And like starting with simple saline is a great way to go. If you need to try some type of anti-inflammatory spray or something, just to see if that, not as a long-term fix, but just as a trial. And then so now you're saying, actually just forcing breathing through the nose can start producing some of those natural chemicals that will achieve that for you.
Yeah, and nitric oxide, it's a vasodilator, you guys. Like that's its magic. That's why it's the magic molecule.
Right, right. So now if someone is, they lay down at night, what about positions? So if someone lays down at night and they're like, I don't want to use any type of devices, I'm not going to use CPAP, but I snore, my tongue falls to the back of my throat. Like from a position standpoint, would there be something that you recommended more?
Absolutely. So a lot of our apneic patients, whether they choose to go for like a mandibular advancement device or they're on a
Mhm,
CPAP, we got to get them on their side. There's
mhm.
a lot of ways to do that, and some are pretty barbaric. Like you
Yeah.
put like sew in a tennis ball on the back of your t-shirt.
Yeah. So
So
you lay
and then
on
they have
there?
fanny packs now that you can
Yeah.
just clip on.
Yeah.
Um, or you could use body pillows, which is a little bit easier. You're
I've
going to
done like a sports. I've talked about a sports bra. Put a tennis ball right there, and this is for cervical spine pain too. And
right.
as soon as you fall into the stomach and it punches you right in the chest, you're not going to lay on your stomach.
Yep.
So I love that one.
Yeah, but I mean, think about that. Why are people on their stomach in the first place? And it's
Right,
usually an airway disorder. Their
right,
tongue is choking them. And so the easiest way to get the tongue out of your airway is gravity,
right.
laying
Yeah,
on your
yeah,
stomach
yeah,
so you can
right.
open it up. And you
Yeah,
sacrifice all the other body parts. Your
yes,
whole skeletal system just
yeah.
gets trashed.
So then, how would we theoretically be able to? Are you able to address that point specifically? If it's because the tongue keeps If they don't sleep on their side, is there a way to reduce that if they are gonna lay supine with some type of movement, stretching, exercises of the mouth?
Absolutely. So the posture plays a big part of it, right? 3 to 6 inches incline on the head of your bed. That's going
Mhm.
to help all the fluids flow properly while you sleep.
Mm,
So
incline, okay.
to avoid, yeah, some of that gravitational issue
Yeah.
and the congestion in the nose. But yes, there's several exercises. You can actually buy tools. Like so, a lot of times people don't have access to a therapist that does
Mhm,
this, that teaches you how to work the tongue properly, make the muscles stronger, and keep them strong. So
mhm.
luckily, thanks to, a bunch of people who are just like, I found a problem and I have the right brain to solve it. We have tools. So I'm going to go through a couple if that's okay.
Yeah, let's do it, yeah.
Okay. So my first and favorite one is this. It's called the remastered myonozzle.
Okay.
And so it's replicating breastfeeding. So you're activating the same muscles that you would have that
Mm,
caused this whole thing to happen in the first place. Because with the bottle, there's like barely any resistance and it's not flat. So our tongues don't learn to swallow properly. And so
mhm.
the myonozzle is amazing. Remastered Sleep sells them. All it is, I mean, if imagine you're drinking a really thick milkshake through a really tiny straw. And so that pull on the middle back part of the tongue where you really want to activate those muscles to get that tongue up while you sleep. This is amazing for it. It's passive exercises, 30 to 60 ounces a day. Through this, you can isolate the muscles in the back of the tongue to make them stay up. I love this one.
So compared to like those big ones that everyone has now with like the regular straw.
Oh, the Stanleys.
The Stanleys, yeah.
Yeah. No, see, the problem is with a regular straw, there's no resistance.
Right.
So this is a workout because it takes so much effort to collect the liquid.
I like it. That's great.
And so it was interesting because I met with the founder and he was like, I was at my parents' house and they had this dog toy where they put peanut butter in it. And the dog like spent hours trying to get his tongue through the little holes and lick the peanut butter out. He's like, that was a workout. And he didn't even know he's working out.
Right. Wow,
it's like, how can we do that for humans?
Yeah.
You're going to drink water anyways. You might as well like get 2 birds, 1 stone.
That's great. I love that.
This is the Mayo Munchie. So it's a product out of Australia. It's a bilateral mastication appliance, and it does several things at one time. So chewing, it improves the entire strength and tone of the upper airway muscles. So you're just doing up and down mastication. It's it creates a better lip seal. So you have to like,
Right. Now you have to
strengthen your lips
through the nose while you're using it.
It habituates nasal breathing and it brushes your teeth. Like it's proprioception on this thing is amazing. Wow. And it's 15 minutes a day. So at the end of the day, a lot of the reason our upper airways are so weak is because of our diet. Everything's super processed. And so we're not chewing tough, tenacious foods for 4 hours a day like our ancestors did. Right. Who, by the way, think about this. Dr. Joe, if I was a caveman, right? And I'm in the cave snoring all night long. Yeah. How many predators do you think would find me a nighttime snack? You know, this is a new phenomenon. Like we're not supposed to be so audible with our breathing while we sleep. Like any audible breathing is a sign that you can't get air in and out of your body appropriately.
Right. You know, side note, I actually think about that. I have little kids with kids. I always wonder, I'm like, how did like ancient tribes migrate with crying babies? I'm like, I feel like babies probably have just taken advantage of us now, and because that would have never been a survival instinct back in the day. Which is, we could save that topic for another time, but I do think about the same things.
You have to, because everybody thinks it's common, so it's normal, and we have to peel back that and say, it's common, but it's definitely not normal. And the longer we go and pretend it's normal, the worse we're going to get.
Right.
So another product is called the Beauty Balloon. So this is actually invented by a pathologist. And so it strengthens the lips and the tongue. Like they have like 100 different exercises on how to use it.
Okay, I've seen that before.
And they call it the Beauty Balloon because it's kind of like an aesthetic appliance. You know, if you're not vain, but you're into like lifting up stuff because you don't want it to drop, you know, the jowls and all that stuff. But this is a great tool. I hate spending money on stuff just to spend money, but I do like if I have something and I bought it, I'm more likely to use it because it was an investment, you know?
Yeah, absolutely.
I could tell people all the exercises, but compliance is really low for a lot of people. I did it for a week and then I totally forgot about it. That kind of situation. So the reason our tongue is weak, especially in the back, is because our swallow isn't proper, meaning it's not a wave-like motion where the tip of the tongue stays on that little, do you see that little hole there?
Yeah.
So this is called a spot pal. It was designed by a speech language pathologist. And you just order it, like you take a little mold and they send it in, and it tells your tongue like an anatomical landmark where it should be when you swallow. So if I can get your swallow proper and you're swallowing the right way, it will naturally keep your tongue strong once you get it there.
Wow.
So
that's a good one.
There's a lot of tools, and they're always coming up with stuff. Like I scour the internet because this is my jam, you know. I want to know like what's the latest and greatest, like how can I help people like make this happen faster? Right. This one is called an up blocker. So basically it's not an exercise like the other ones, but it helps you be aware of your tongue posture. So
Mm.
if you put it in and your tongue is suctioned to the roof of your mouth at rest,
Right.
this little valve will be indented. And then if your tongue isn't in the proper resting position, and a lot of times this is great for teens and kids, because you'd be like, oh yeah, your tongue is up because the little valve is sucked in. But if it's not, while they're playing games or whatnot, you can
Oh,
use it
it's
as a
visibly
biofeedback.
out?
Yeah. Uh-huh.
Oh, okay, and that's
So if my
interesting.
tongue is up, the
Yeah.
valve is in. This
Wow, that's
this is
cool.
yeah, these are forward Dontics. They're coming out with tools all the time.
Well, I mean, everything comes down to the nervous system's ability to maintain the correct habits and positioning.
Mhm.
And so, like, reminders are the most important thing. I mean, no stretch, no exercise matters unless you can then activate the nervous system to maintain that position and utilize that position. So it always
Exactly.
comes back to that feedback.
And we're resetting. I like to say we're resetting the software and the existing hardware,
Hmm.
so we can use all the help we can get to where those neurons fire together so they can wire together.
Right. Yeah. I love those tools. Um, so what else? What have we not touched on so far?
Well, I can tell you the clenching and grinding.
Yeah,
So
let's do
every
that.
time I watch one of your videos, I think about this. Right before I went to that CE, that continued education course where we talked about oral sleep appliances, I was in the process of patenting this.
Really?
I thought it was normal that everybody's face hurt. I thought everybody woke up with a sore face. Like that's just
Right,
how it works.
right.
And so I was trying to find something I could put to the market
That's pretty
that
cool.
that would help relieve that masseter pain and then
Right.
come up to the temporalis. And you could even, like, if you were a contortionist, get a little bit of the cervical. But
Yeah.
I couldn't sell it. I had to stop because I
Really?
realized that this was just treating a symptom.
Right,
And I didn't want to be known for that. I didn't want to be, and
right.
everyone's like, oh, you should still, patent and make
Yeah.
it. I'm like, no, because your face shouldn't hurt. And it's probably a tongue airway problem. Like, why would I use a tool to treat a symptom? I
Right.
couldn't in good conscience do that.
Yeah, yeah, yeah. Yeah, I mean, I do think that the root cause is the most important thing. So something is gonna be triggering the nervous system to produce pain there. Now, sometimes muscles might be tight because the joint is tight, so it needs to overcome the resistance of the joint, so it needs to constantly work harder and then produce that tension in the muscle. Or the nervous system for some reason, if you're in pain, if your nervous system's hypersensitive, it's making the muscles be tight. Um, I mean, I don't think there would be anything wrong with using that to make yourself feel better temporarily. I always think of it like priming the system. So for example, if you think about um like if getting yourself mentally in the right state to start healing. So if you have someone and you know their joint for me or their airway and you need to start working, if they're like this locked in pain, and you throw heat on them and just loosen it up, their nervous system calms down and they're ready to accept treatment. It's definitely not a root cause
Mhm.
approach, but I don't think that there's anything wrong with where your mind was at as a compliment, like
Right.
as a compliment too. But I wouldn't sell it as like this is going to fix the issue for you for sure.
Well, the tongue is a natural splint for the TMJs. And if I can get your tongue suctioned to the roof of your mouth, your face should stop hurting. For a lot
Right.
of my cases, I mean, it's almost 100%. Their face
Just
stops hurting when they get their tongue to stay suctioned to the roof of the mouth
and
at rest.
they start nasal breathing, you mean?
Yeah, because you stop compensating, you stop using compensatory muscles of the face. You just allow the tongue to transfer the food and liquid down your throat. You're not clenching and grinding anymore because your airway stays open. And so at that point, I was like, I saw it was two hand in hand, where like just getting the tongue, like making that the priority,
Yeah, yeah.
getting that
No.
tongue up.
Yeah,
So
I think if you have no, I think you should 100% attack I talk about this in a lot of the lives too. What's the biggest lever that you can pull to get yourself to feel better? Like, and then just spending your time there and focusing your effort there. And I feel like that's the name of the game. Like, what is
it
the
is.
most important thing? Because there's always so many factors, but what's the biggest one that you can do right now?
Well,
And that,
that's my favorite concept is just getting people, finding language that they understand, right? So the three most important things for the human body:
mhm,
oxygen, water, food. And it's always in that order. I could give you all the food, but if you can't breathe, it's
yeah,
pointless. I
sure,
could I you know, I could get you all the water, but if you can't breathe,
Right.
being hydrated doesn't matter. So
Yeah.
the breath, I think, is the lever for the entire system. Like I'm a wartime veteran, right? And I always thought like PTSD was just me reliving all these experiences that I had that were really scary. But I
Mhm.
realized it was connected to my breath. Is so
Right.
every time I would go back, and a lot of us vets do that, we relive these very scary situations and we
Mhm.
create that pattern of breathing that we had when we were in them. And
Right.
so the body does, your brain's, doesn't know if it's not real. And
Right.
so you're
Yeah.
reliving these situations. What could I have done differently? Like how that made me feel, the things that go through your brain. And if you can reset that breathing pattern, you stop holding your breath, you focus on that slow and silent nasal breathing, you hum more through your nose, you
Mhm.
can you can reset a lot of that stuff.
Yeah, yeah, absolutely. I mean, that's what healing oxygenation produces healing. So, that's a huge piece of the puzzle. And we know that clenching and grinding is directly tied to the airway and the nervous system. So it's not going to be, you can't, a muscle doesn't tighten up because it wants to. It tightens up because it either has to overcompensate for something tight, so it has to work harder, or the nervous system causes it to go into a dysfunctional spasm, basically.
Yeah, if you're running from a tiger, which is a very stressful situation, you're mouth breathing. And so again, the brain a lot of times doesn't know what's real and what's not.
Yeah,
And so if
yeah,
you're mouth breathing, it just assumes you're running from danger. And
yeah,
so it keeps you in that fight or flight. And it's awful because
yeah.
I didn't know I was doing it to myself.
Right. Yeah, it's true, and vice versa. If you are in a stressful time in your life, if you have different type of health anxieties and you trigger the fight or flight response, then you're going to start mouth breathing as well.
Yeah.
So it's like that also leads you to the chicken or the egg piece of it as well. Yeah.
Yeah, it really does. And it's all connected. I remember it was like a year into my breathing journey. I call it the airway journey because I'm kind of
Hmm.
cheesy about that because I think it's the upper airway, like less airflow resistance equals a happy, healthy life.
Right.
And I remember, I just moved to Montana like a decade ago. And so it snows for like 4 months out of the year here.
Really?
And I'm from Virginia originally. So like driving in the snow was very scary for me. And I would just grip that steering wheel, like white knuckle it the whole way to work from my home. It's like a 35-minute drive. And I
Yeah.
would be stuck in like so much stress. And then as I started engaging my diaphragm, slowing down my breathing, getting better sleep, my knuckles just, I looked at them one day and I was like, why am I not gripping? Like, this is my normal. It was one of those system resets that happened automatically.
Right.
Just like an anterior pelvic tilt. Used to have one of those. Kelvin
Yeah.
or kyphosis, used to have that.
Yeah.
Like
Yeah.
all these things just start to auto correct when you pay attention and you do the work.
Yeah. Absolutely. So, and then is there anything else that you want to touch on?
Well, if you guys want to know what to do, you're going to go through, like, especially if you think, oh no, I make sounds when I breathe while I sleep, or I wake up tired. You don't always have to snore. You could still have airflow resistance,
Yeah.
and you can go through and find out. Almost all the experts are talking about the problem. So they're going to say, it's underdeveloped cranial facial respiratory complexes. It's malnutrition. It's tongue ties. It's all these things. I got tired of digging. So I wrote a book called Breathe Better While You Sleep. And
Mm,
it's just a guide on what to do. And it starts from like, it's in sequence, get the nose to work better, get your
right.
tongue stronger.
Yeah.
Let's keep your tongue strong. Like, what can you do about sleep hygiene? And
Right.
so I'm really proud of this.
That's
It's on
great.
Amazon,
Congrats.
it's in Kindle as well. And
Yeah.
hopefully we'll have an audiobook soon. But yeah, just breathe better while you sleep. I'm not telling you that I will help you cure sleep apnea. I never make any claims. I just want you to be better. This is which we all want to be better. We want to live here on earth and enjoy our 100 years or so and not have to like struggle to breathe while we sleep.
Absolutely. I mean, it's a spectrum of, it's
Yeah.
always a spectrum. There's people, like you were saying before, like what is the cause? Is it some type of obstruction in the nose? Is it the posture? Is it the inside the mouth? If you have developed severe, cranial deformities at birth and now you're 40, you can't change the structure of your face. So like some of those more severe cases may need more medical intervention. But the
Yep.
only way to know where you fall on that spectrum is to try. And it always makes more sense to start conservative and see if it solves your problem. And It will solve it for some people in the beginning. Some people will get to the middle and it'll solve it then. And some people will go through the whole thing and they're still not happy with the result. This is for anything. And then you look at the next step, but it never makes sense to start with severe, expensive, like actual physically changing your body treatments. Like, and I think
I
that's just
ugh.
across the whole spectrum of healthcare. That's the best approach.
And we're programmed like that, right? Is a pill for your ill. Like, what's my solution? If I can't buy the solution, is it really a problem? Like, come on.
Right.
Like, where can I buy it on Amazon?
Yeah.
And so we're kind of like set up for failure, if you will, because we always think that it's the form. It's the form that's the problem. Like, no, but function caused the form to be this way.
Yeah.
And so I always love to say function first, because there's so many things you can do to heal the body
Yes.
with just using it right.
Yeah. It's true.
We got to find out how you're using it wrong,
Yeah.
and then help you learn how to use it right, and then things will, in a lot of cases, autocorrect. And we see this in the oral facial world, where these, you guys are going to see them. They're called maxillary skeletal expanders.
Mm-hmm. Right.
And so everybody's like, oh no, my tongue wasn't on the roof of my mouth when I was growing and developing. And now I have a high vaulted palate and the nose is small and I can't get air in and out of it. And then they go to a doctor and he says, oh, I can put this expander in and we'll open up your nose and create more room for your tongue. And that's great. But the majority of people, if they don't address the function, having that extra room doesn't do much for them.
Yeah, absolutely. That's why it's like, that's why, yeah, same thing in my world. Like if you need a surgery, you have to do the rehab after.
Yeah.
Or
I mean,
before.
physical therapy is
rehab too.
It's everything.
Yeah. Before and after. Wow. We touched on a lot of stuff. So, I'm tempted to just do a quick recap of just understanding that there's different types of sleep. There's sleep breathing disorders, and within that is sleep apnea, which is one of the most severe ones. And then there's more of a central and obstructive. And we've been talking about obstructive. How is your own body preventing air from getting into your lungs properly, basically? And all the ways to look at it from the neck below. But then also when we get right into this area of the mouth, and that involves exercises, it involves sleep positions. And I know we could also go into all other inflammatory treatments, and there's a lot more to go from there. But I think we really touched on a lot of great stuff.
Well, if you guys need to know more, Airway Coach, if you're not good at reading or you don't like it, I am a co-founder of a company that does one-on-one consults, and we have video modules on how to slow down your breath, how to make your nose work better, how to get your tongue stronger, how to get that sleep hygiene dialed in. Like, you don't have to dig. Myself and my partner, Dr. Galan, we're happy to help you.
Thanks for sharing that. That's great. People know where to go.
It seems overwhelming at first. I've been there. So I'm doing my best to make it as easy, streamlined as possible, so that people can start breathing better while they sleep tonight.
That's awesome. Well, thank you for sharing all that, Rhonda. I really, really appreciate it. I think everyone had a lot of value here. And for anyone who wasn't able to join, they'll be able to rewatch this on any of my platforms, and then we can send you the recording too, so you'll have it.
Thank you so much for having me. I love all your videos, by the way. I'm a fangirl. The ribbons, I mean, they're so helpful.
Oh, yeah. Thank you. Yeah.
Knowing where all these fascial lines are, because it's really hard for us, dental folk to look past the neck. So I really appreciate it.
Yeah, you're welcome. That's kind of what we obsess with over here. Like, how can we better explain the situation? And then bringing on people like yourself who are experts in different areas just helps kind of tie it all together. So thank you so much. All right. You have a good one. And then maybe we'll do this again sometime.
Thank you.
All right. Bye-bye.
Bye.